Illinois lawmakers are looking for new ways to help people struggling with mental illness in the state. Today, the House Mental Health and Addiction Committee held a hearing looking at psychedelics as a potential behavioral health treatment tool. Illinois Capitol Bureau Chief Max Cotton reports.
We are in the midst of a behavioral health crisis in this country and in this state. And that includes mental health, it includes addiction, it includes an urgent need for trauma support.
Illinois state lawmakers have looked at several potential solutions to address the state's behavioral health crisis. They've already held previous hearings this year on the behavioral health care worker shortage and how to spend settlement dollars to increase access to care. Tuesday, they discussed a less traditional form of care, psychedelic drugs, specifically psilocybin, also known as magic mushrooms.
Psychedelic medicine work in a completely different manner than traditional meds. When we look at psychedelic medicines, they really have two prongs of how they approach treatment. One is a psychological benefit and one is the medical benefit.
He says it allows people to look at their previous trauma or at themselves from a new light, allowing them to potentially reframe their trauma and get to the root cause. There are bills in both the State House and Senate to legalize psilocybin for medical purposes. Known as the Illinois Cure Act, it would create a state-regulated psilocybin program allowing licensed facilitators to provide supervised therapy. Psilocybin would remain illegal for recreational use. The DEA currently classifies psilocybin as a Schedule I drug. However, the FDA granted it breakthrough therapy status.
Those with mental health issues deserve better. They deserve more than what they've been given, and they deserve hope. And we, as providers, researchers, government officials, policymakers, have a responsibility to do our part in advancing new and promising treatment options for them.
In Springfield, Max Cotton, WGEM News.